The restrictions on dental practice, as well as understanding COVID-19 and patients' comorbidities, have led to multiple variables to consider when booking patients in for dental treatment. As a result, the ADA have released the decision tree for Level 3 patient management. The decision tree walks you and your team through the decision-making process when booking a patient in and the precautions that you should take. Firstly, you need to determine if the patient has a dental condition that meets the Level 3 restriction criteria. Secondly, you need to determine the patient's COVID-19 risk factors and comorbidities. Once these have been determined, you can decide if you can treat the patient in your practice or if they need to be deferred or referred to a specialised facility. The answers to these questions also determine what additional precautions you should take and what PPE should be considered. As we are all aware, following standard precautions is something that we have become very familiar with in terms of our standard infection control in dental practice. However, since COVID-19, we are also being advised to follow additional precautions, and these include encouraging patients to attend alone or only bring minimal additional accompanying persons, being mindful of consent requirements and family commitments. Longer appointment scheduling to allow enough time between treatments to enable additional infection control measures, including the environmental cleaning. Staggering patient appointments to minimise patient contact in the waiting room. If there is a car park on site, asking patients to wait in their cars and call the practice upon arrival. Completing pre-appointment questionnaires over the phone or allowing the patient to complete these while waiting in their car. Upon arrival at the practice, asking the patient to use an alcohol-based hand rub or wash their hands with soap and water. Removing unnecessary items from the waiting room, including toys and magazines. Adjusting seating in the waiting room to ensure social distancing of at least 1.5 metres. Regularly wiping down surfaces which a patient may come into contact with, and this could include door handles and reception desks. Asking the patient to use alcohol-based hand rub or wash their hands as they enter the dental surgery, before they sit in the dental chair, and asking the patient to undertake a 20 to 30 second pre-procedural mouth rinse with either 1% hydrogen peroxide or a chlorhexidine. Avoiding procedures that generate aerosols, and where there is no reasonable alternative to provide urgent necessary care without generating aerosols, use high volume evacuation and rubber dam. This would also include irrigating the area with chlorhexidine or sodium hypochlorite after the dam has been placed to reduce the aerosolization of infectious agents. We encourage all of you to have the decision tree for Level 3 patient management printed as a resource for you and your staff so you can continue to practice safely throughout the COVID-19 pandemic.